Well, let's go ahead and begin this presentation on the use of social media in a men's health practice. I am trying to inject a little bit of Santa Fe flair into the meeting with using the background of the Cathedral of St. Francis of Assisi from Santa Fe as my background today. We'll go ahead and get started now. And, building a men's health practice requires not only high quality compassionate care. You've got to be a good doctor, but you've also got to get the word out to let men, potential patients, know that you have a men's health practice. You want to market yourself, you want to educate patients. Now, as we're doing this presentation, if you see me looking down, I'm looking at the screen or looking at my keyboard. So don't take offense, but we've got to get the word out. We have to let men know that we have this kind of practice available and that you're available for them. And like I said in the slide here, word of mouth is great, but it only goes so far. And it's 2020. We used to use things like yellow page ads, or we would use printed flyers. You would even use television and radio messaging, but these things are becoming less and less effective over time. What's becoming more and more effective is using social media platforms. The ability to leverage these platforms to get the word out is a must, because you want to reach the widest audience and the greatest number of potential patients and their spouses. Now, what I'm saying in this talk, what follows, is based upon my personal experience building a practice in prosthetic urology and men's health. Others may disagree with what I say, but this is what has worked for me. And to be honest, when I've guided other individuals and asked them or encouraged that they start using social media, and particularly as we'll see YouTube, it's worked well for them as well. I've been out of residency 21 years, but I began to focus my practice on prosthetic urology and men's sexual health about 16 years ago. And I did not do a formal fellowship in prosthetic urology, but I knew that it was important to really gain a surgical skill set to be able to take care of not only routine patients with erectile dysfunction and Peyronie's disease and incontinence, not only the routine patients, but also the more complex patients. So I knew I had to up my surgical game. And so I reached out and I formed mentoring relationships with some individuals, two of which have been particularly important. That would be Dean Knoll, who probably many of you know practices in Nashville, Tennessee, and of course, Steve Wilson, one of the giants of prosthetic urology. I sought them out. They've become true mentors to me, and they've really helped me out with my surgical skill set. I thought it was really important to become active in the sexual medicine and prosthetic urology societies that are out there. And so, just like I found mentors in surgery, I became involved in the societies and I formed mentoring relationships uh, with individuals within the societies. And of course, one of whom is intimately involved with this meeting, Mo Cara from Baylor. He's been tremendously helpful to me, helping me to understand how to navigate within the society, the Sexual Medicine Society of North America or the International Society of Sexual Medicine. Mo's been really helpful. John Mulhall up at Memorial Sloan Kettering, so important in prosthetic urology and sexual health, but John's been really helpful to me. So these mentoring relationships to develop surgical skill set and also to function within the societies have been really helpful. I think getting involved with the societies is important because patients they want to know that the individual they're seeing, the doctor they're seeing, has bona fide. They want to know that the doctor is the real deal. And if you're involved with the societies and perhaps produce literature or give talks, or at the very least attend the meetings regularly, that's going to count to patients. So, when I was focusing my practice, I wanted to get the word out to potential patients. And so I did, like a lot of you have probably done, like a lot of individuals do, I organized community health talks. And I worked with industry, with then American Medical Systems, and now, of course, Boston Scientific, but also Coloplast. And we would use patient lists from within my practice and print media ads, and we'd give these community health talks. I sought out opportunities to appear on local radio programming, and those things were helpful. But what I found is that over time, these efforts really yielded smaller and smaller returns. I just wasn't getting as much bang for the buck, if you will, in terms of doing things like the community health talks. And about 3 years ago, I began to realize that men were getting, and patients in general, men, women, whatever, were getting a lot of their information online. And so the first step The first step that I took was at the urging of Paul Perito. Again, many of you probably know Paul. Paul's a giant in prosthetic urology. He's a superstar, practices in Miami or just outside Miami in Coral Gables, Florida. Paul really encouraged me to develop a personal website separate from my group's website. And I did that, drbrianchristine.com. That's been tremendously helpful. It provided a platform for me to kind of express my philosophy and my take on prosthetic urology and men's health. Uh, it allowed me to post images and pictures from surgical procedures or from my patients on the website. And it also allowed me to develop a real concierge feel to my practice. And I know that a website is not strictly within the realm of social media, perhaps, but I highly, highly recommend building a personal website, a personal platform that's going to show off your personality and your ethos and how you approach things. And that image at the bottom is kind of the homepage of my personal website. So that's been really helpful. But I'll tell you what's been equally as helpful has been diving into social media, because if you get involved with social media, make your presence known on social media, it's going to increase your reach beyond the geographic boundaries of your practice. Things like Facebook and Instagram and Twitter and LinkedIn accounts, you can post images, you can put commentary, you can link to your website, and that's really, really helpful. So I think those things have been helpful to me. But I'll tell you what's been really helpful to me has been another platform that's been, the biggest platform for me has been YouTube. And this is the homepage of my YouTube channel. Uh, and I think that, again, Facebook, Instagram, Twitter, LinkedIn, yeah, those things have been helpful, somewhat helpful. Maybe for others, that's the most important thing for them. But for me, clearly, it's been the YouTube channel. And at the time of me recording this presentation, I can tell you the vast majority of men who seek me out on their own, in other words, who aren't referred by a specific doctor or someone within my own practice, the vast majority of these men, they seek me out. They do so after having watched one of my YouTube surgical videos. And at this point, there have been over 150,000 views of my videos, and the view time is now approaching about 4,000 hours. There's about 45, 47 videos on my YouTube channel. So you think about that, 150,000 views and nearly 4,000 hours of view time. That's a lot. That will really help you get, and has helped me really get the word out. Now, my patients who come from having watched my YouTube videos, they come primarily from the Southeast, but not exclusively. I've had men from all parts of the United States who have come to Birmingham after having watched YouTube videos, come to Birmingham for consultation and for surgery. And I'm seeing an increasing number of individuals come from outside the United States. And these have primarily been from Europe, uh, from Canada, and from Latin America. But again, all of these individuals that I'm referring to now have come because they've watched my YouTube videos. Patients are going to seek out perceived excellence. And if you have a library of high quality educational videos on a YouTube channel, that's going to let the potential patient know, hey, you really know what you're doing, and they'll seek you out. I think there are some real keys to success on YouTube videos, and I've listed them here for you. I think they're really important. Clarity of the images in the video, uh, the fact that the videos are edited to highlight key steps within the surgical procedure. You have to have really crisp audio, and you have to have a patient understandable commentary or description of the surgery being viewed. Those things, patients have told me, are what they really like about my YouTube videos. Now, yeah, you can use a cell phone to record your videos, but don't do it. You want better quality than that. Use a video camera or a DSLR camera like I do. These have a much higher quality images, and that's going to pay off in terms of how the video looks to the viewer. I really think that shooting in high definition resolution is important. I think a minimum would be 1080p resolution, or even better, 4K resolution. I do everything in 4K. Now, if these terms don't mean much to you, don't be intimidated, because they meant nothing to me before about 3 years ago, but you'll learn along the way. Suffice it to say, high definition resolution is going to be really important. And it's important because the higher the definition resolution, the more data you're going to have within that video that you've recorded, so that when you go back and edit, you're going to get a better looking image ultimately. Uh, the camera has got to be positioned such that you can get excellent framing of the surgical site. Now you can have the camera mounted overhead, or you can have it mounted on a tripod. I've used both and I use both, but you got to position the camera such that you've got a really good framing of the surgical site. The patients have to be right in there and see what's going on. They've got to be close up. So you have to really get these images framed up nicely, lighted well, good color correction and color balance. Again, all these things are not difficult. If I can do it, I promise you, you can do it. But these things are important. One thing that I think is really important and that I think has helped my videos to have a good look to them has been a separate dedicated monitor that I use. It allows me, the surgeon, to see what's being recorded. Okay. So, in other words, if I can't see what's being recorded, if I think I know what's being recorded, I may not be right. So using a separate, and I'm going to show you this in a picture in just a second, using a separate monitor that's just for me is going to allow me to know that the things that I want to highlight in the video, whether it be, dilation during a penile implant procedure, or the dorsal dissection around the spongiosum during an artificial sphincter, or as I've indicated here, when you're anchoring the mesh during a mini Joupette procedure for climacturia, I want to be sure these critical steps are being shown. I've got to know that video is being captured and the images look good. And so I use a separate monitor. So this picture, this is my setup. So on the far right of the picture, what you see is my scrub nurse, who is absolutely amazing. Jamie, she's the best ever. And actually, she now works with Coloplast, and that's a great addition for them. Uh, but just to the middle of the picture there, you can see my camera setup. So there's the camera mounted on a tripod. Above the camera is a small monitor that my videographer uses. And my videographer, as it turns out, is my circulating nurse, Judy. Judy is an amazing circulating nurse, but she's really good with the camera. We've learned together how to do this. So that monitor lets Judy know when things are lined up right. But then at the far left of that picture, indicated by that arrowhead, is my monitor. And so I have that clamped to an IV pole, and I put that across the table for me so I can see exactly what's being filmed and know that the steps that I want to make sure that we have being shot are being shot and the video is being recorded. So that monitor is important. If you want to get images like this, on the upper left is during a sling procedure and the bottom right is during a mini Joupette procedure, these were critical things that I wanted to show during the video. I had to make sure that we were capturing them, and that dedicated separate monitor for me to look at let me know I was doing that. Editing is important, and you have to edit to highlight the key steps. You don't got to show them everything, just show them what's important. So don't show them every step. Figure out what's important to you to convey that image or that messaging to convey to potential patients. Edit to those. The available software for editing, the software is out there. iMovie is an Apple product, and it's usually part of, let's say, a MacBook or a MacBook Pro or an iMac. Final Cut Pro 10 is more advanced. It's affordable. It's what I use. It really gives me a lot of flexibility and a lot of power as I edit. And then if you like a PC-based system, if you use a PC, not a Apple product, then Premiere Pro is a really good program for editing. Now, all of these things are pretty darn user friendly. They take some practice, but they're easy to engage with and learn how to use. I really think you ought to consider including some video of yourself on your educational videos. I don't do this all the time, but I do it a lot. Maybe 30 seconds or a minute of me talking to the camera, introducing the video, and then a bit at the end to close things out. I think if you speak directly to a potential patient in the video, that's a great way for the patient to meet his surgeon and to get to know you. It's pretty powerful. When you're doing this, don't rely on the in-camera microphone. So if you're shooting video of yourself, don't just rely on the microphone that are in the cameras, because all these cameras have a built-in microphone. Don't rely on that. Remember, I said that it's important to have crisp, clear audio as part of your videos, and you're not going to get that high quality audio you want if you rely upon the in-camera microphone. So invest in a better quality, let's say a little clip-on microphone, lavalier microphone, clip-on microphone that you can then connect up to the camera, or you can use a separate camera or boom mounted microphone to record your audio. But these are going to give much better audio than relying upon the in-camera microphone. So do that, make the investment. And then when you video yourself, some people are very comfortable speaking without a script, talking to the camera, speaking without a script. Some people aren't. If you're not, then you can get camera mounted teleprompters to read your scripted comments via cell phone apps. And this is one I have. And so the picture on the left is my rig setup when I'm recording myself. And there's that teleprompter snapped onto the front of the lens. So on the left is what it looks like from the side. On the right is what I'm reading. So that script that you're seeing there is being projected up onto the teleprompter. I'm able to read it off. And because the teleprompter screen is right in front of the lens, you can't tell that I'm reading it. So these teleprompters can be really helpful. So that's when you record videos and post them. But there's also live stream, and that's another platform on social media. Live streaming is when the surgeon broadcasts live and people watch real time on computers or pads or smartphones, and the viewers can submit questions and comments. Now, I've live streamed from the operating room during surgery. I've also live streamed from my office with a patient who had a procedure. And we did a live stream. I've live streamed from my office, just myself or me and my fellow talking. But live stream can be really powerful. It can really let your personality show through. YouTube and Facebook both have live stream options. I think when you're doing a live stream, don't just wing it. What I mean is really think about what you want to say and the points that you want to make beforehand. If you need to script it out, or at least write out an outline and be familiar with that. Because if you don't, and you start live stream, when you get on live stream, you're going to find out that maybe the things that you wanted to say or the points you want to make, you never made them. So kind of put some thought into this and then script it out. But live stream is a great way. It's another social media platform you can use, and it can really help grow the practice. When you live stream, so the patients or the viewers are watching you right then, but then the live streams are archived. For instance, if I do a YouTube live stream, that live stream is recorded and it lives forever, not just the live moment, but it's there forever. And you'll get most of your views over time as people watch these things. Live streaming is a great way to do things. Using social media, like I said, is really important. For me, it's been YouTube. That's been the key to helping me grow my practice. I will tell you that for me, since I've really started engaging with my website and social media, specifically YouTube videos, my Peyronie's disease practice has grown by literally over 50%. I crunched the numbers just recently for an article that I'm working with Dr. Wilson on use of social media to grow practice. My Peyronie's disease practice over the last 3 years has grown by over 50%. My prosthetic urology practice has grown by over a third. And I think really the social media has made a big difference, again, specifically for me, YouTube. The biggest roadblock to using social media is just not making the commitment to start. It's intimidating to think about, particularly, I'm 56, particularly for us men and women as surgeons and practitioners who are perhaps in this age group, not necessarily intuitive, but it's worth making the effort. So start shooting, start editing, start publishing videos and posting on social media platforms. Figure out what works best for you. Some people, I'm sure, will say that Facebook or Instagram or whatever else works best for them. For me, it's been YouTube that's worked best for me. Figure out what works best for you. Because I'll tell you, the potential to increase your reach and to grow your practice is tremendous. So I highly recommend it. Again, if I can do it, I promise you anybody can do it. Thanks for watching. I really appreciate MoCare and the rest of the Baylor faculty letting me participate. Hope you enjoy the rest of the conference.